I think for Zipline, we are very interesting case, right? We are at the intersection of two highly sensitive industries, right? One is aviation and the other is healthcare. And so, public-private partnership for us, it means a lot more than what other people can think, right? Public-private partnership is not only coming together and implement a project together. For us, it's how fast can a regulator change their mindset about drones flying in cities, right? Drones without pilots flying in a capital city near the airport, for example. And that's the success that we're seeing today. Regulators are really letting their guards down, being much more open of like, let's test and then evaluate after and then build a solution on that, right? And that's both in Rwanda and Ghana, and they are really opening up to do those kind of things. So that's one side, make sure that all the barriers that could exist for these to be enabled to just remove them. And we were very impressed by the regulatory agencies in Ghana. In 24 hours, they had already cleared us to fly into the city, while we usually had a no-fly zone around an airport, right? And then on the other side, on the implementation side, is also understanding like where can we add best value. And one of the things is that usually the private sector players will always go try and convince the government of where we think we can add value, and the public sector. But at this point in time, it was more of, we have an unprecedented pandemic at hands. We want all hands on the deck, and can everyone tell us what we can do? And it doesn't need to go through a long form of evaluation. As much as there is a need for due diligence, there is a need for proper evaluation of what needs to be done. One thing we are seeing and kind of really appreciating is the need of moving faster. And so where we see this moving forward, it's more of how do we remain very integrated? How does this momentum remain there? And that's where we're really curious to see how we could be able to add much more value, and we expect the public sector to be much more adaptable and open to quickly enable some solutions that address the problems in the fastest fashion, without really relenting to that. But I also think companies like ours and other players should be much more open to building agility into how they operate, like being able to quickly adapt your technology to serve this type of demand. No one knew that this was coming. We didn't necessarily build our technology to respond to this, although we knew that it was built for something like this. We just were able to be very agile, and I think that's what's surprising a lot of people. The government sees a need. It takes us less than 24 hours to respond to that need, right? We adapted our operations, we adapt our processes, we adapt everything as fast as possible within 24 hours. So that agility that has to be built into how, both from the core design of your technology all the way to how you operate your services and provide your services is really important to be able to be of great value to the public sector whenever there is a need to do so. It really depends on the value that we add, but I think the current scenario, what it allows is everyone is open-minded, right? What's priority is, can you solve a problem? Whether that's manufacturing personal protective equipment, creating point of care testing and diagnostics and treatment. There are ways, like all guards are down. Everyone really wants to find a solution, and that's where a lot of startups can tap into. Regulators are scrutinizing less or demanding less, and that's really important for the startup scene to be able to thrive. So it's really important to seize the opportunity while remaining very responsible of what acts you are going to be taking around this time. But this is a great opportunity to bring the solution to fruition as fast as possible, given how fast everyone wants to be moving. I think it depends from where I look from, right? In different parts of the world, COVID is pretty much impacting everyone equally. But there is a greater, and we are starting to see this, especially in countries like the US, and even that's the main fear in Africa as COVID starts to spread on the continent, is that it will disproportionately impact poor communities. And we already have experiences with this, right? So with AIDS, TB, malaria, there were pandemics at the time. There were large-scale outbreaks and epidemics, but now they have receded to only be prevalent in poor populations and underprivileged populations. So that's a pain point. And you know, no one who is poor should have to wait for mega investments in infrastructure to access care, for example. There should be a way to ensure that care is accessed wherever someone is. And that's why we are really proud to be able to enable that using our own innovation. You know, we don't need roads, we don't need, you know, fancy technology. We can fly over places and make sure everyone has access that they need. We enable access to vaccines without needing a fridge. So we just give to you the vaccine exactly when you need to inject it and carry out a vaccination campaign. We kind of enable that. And technology has to be there, and innovators and anyone who's trying to bring a solution has to be really responding to those particular needs. And as you know, as I was telling you, in rural areas, we saw the real problem that would make it so hard to address COVID. You know, they have to wait to get 200 to 500 tests to drive to the city. That means that they may not impose quarantine as needed. They may not give back results as needed, you know, creating some sense of panic. They may not protect healthcare workers as needed. But because our technology was there, because it was embedded within the health system, we were able to respond quickly. And just like in the city, any health facility turns around 2 to 5 tests every, 30 minutes or so. The same rural health facility can have that similar amount of turnaround, right? And we are bringing down that disparity by just enabling a 30 minutes flight instead of a 6-hour drive towards the laboratory. So I think it's that responsibility that innovators and startups and everyone who's trying to respond to this should be able to address. And I think, that's how we are working to address that particular disparity. And I hope and I wish there would be either us, we would be in many places doing this, or there would be many like us doing this.